for Jackie Walsh?
That's me.
Hi, nice to meet you. How are you doing today?
Okay, how are you?
Awesome. I'm going to be your dental hygienist student today. If you want to come in and have a seat in this black chair.
Okay.
Perfect. So for today we have a couple assessments to be doing to get a baseline for your overall health. How are you feeling about it?
I'm a little bit nervous actually. I've had really bad experiences with the dentist, so I don't really like coming here.
Okay, thanks for telling me that. Would it help if I explained all the assessments we have planned for today in great detail? That way you can ask any questions or add any notes you have anything about it to make you feel more comfortable?
Yes, please. I feel a lot more comfortable when I know everything that's going to be happening.
Okay, absolutely. I'll go through all of them now. Then I'll warn you as I perform each of the assessments. Any thoughts you'd like to add now to make you feel more comfortable?
No, I think I'm okay.
Perfect. So there's a couple different assessments we'll be doing today. Assessments today we're going to be checking. It's going to include checking your vitals, checking the overall health of your teeth and gums, and then we're also going to be taking some x-rays just to make sure anything that I can't see with my eyes, just to assess them.
Okay, I've just had this done a few years ago, so like, why do you have to do it again?
Okay, so we need to take a new baseline. Because the ones that you had done a few years ago aren't really up to date. We just want to make sure everything's still on the same healthy line as it used to be. Let me just double check. Alright. Does that make sense?
Yeah, I guess so.
Okay, perfect. So we'll start by taking your vitals, which is your blood pressure. So we're going to take this cuff. It's just going to slide around your arm, and then I'm going to pump some air into it. And then I'm going to take this and just place it on your arm, and it's just going to tell me what your blood pressure is at. Nothing too scary there. And for your heart rate, I'm just going to take my fingers and rest them on your skin, and I'm just going to count to 6, and then I'm going to multiply that by 10, and that'll tell me your heart rate.
Okay.
So how'd you find that?
That wasn't too bad.
Perfect. I'm glad. Before we start your head and neck exam, can I ask you to take off your glasses and scarf for me?
Sure.
Perfect. I'll just put them over here for you. Thank you.
Thank you.
So next we're going to do a head and neck exam. So basically I'm just going to start around your neck, jaws, and ears. I'll work up your neck starting from your collarbones. I'll let you know what I'm doing and if I need you to turn your head or anything like that.
Okay.
Perfect. So I want you to feel comfortable here. So we'll move on to your oral exam next, where I'll be assessing the health of your teeth and gums. And just the entirety of the inside of your mouth.
Okay. Could you actually explain to me why you need to do this?
Yeah, so I just need to check the entirety of your mouth. So what I'm going to do, I'm going to start by lifting your lip down, and then I'm just going to pull your cheeks out just a little bit, not too hard. I'm just going to check the inside of your teeth, inside of the cheeks, to make sure they're healthy. If at any time it's hurting, just raise your hand and let me know, and I'll stop, and we can take a break for a little bit.
Okay.
And then I'm going to take my mirror right here and shine it up at the top of your mouth. Just shine some light up there just to make sure it's all healthy on the top of your palate. Then I'm going to take my fingers and just press a little lightly on the floor of your mouth. It shouldn't hurt at all again. Just feel a little bit of pressure. Shouldn't hurt. It's just going to feel a little bit awkward.
Okay.
How does that sound?
That sounds good.
Okay, just let me look here. Okay, so our next step is going to be the hard tissue exam. I'll be taking this instrument. It's called an Explorer, and I'm basically just going to run it around each surface of the tooth very softly, just to see. It'll tell me where there's any plaque that I can't visibly see, and it'll also tell me if you have any restorations, if you've got any cavity filled, I'll be able to tell where they are, so I know what I'm looking for.
It looks a little bit sharp. Is it going to hurt?
It's actually not sharp, so it has a really blunt end. Do you see that? And I'm going to be using a really, really light grasp. I can actually show on your hand with my pen, so I'm just going to be doing very short and light strokes.
Okay.
Okay. Thanks for letting me know, and so I can tell you more about that instrument. Okay. So the last part is the hard tissue exam. I'll be measuring your gum tissue, so I'm going to take this other end of the instrument. It's called a probe. Again, it's not sharp, it's very blunt.
Okay.
So basically between the tooth and your gums, there's a little pocket, and that's just going to tell me where the gum attaches to the tooth. So it's going to measure in millimeters, so 1 to 3 is healthy. Anything above 3, I'll just advise you to change a little bit in your oral health care. If you need me to stop again for any reason, it shouldn't hurt because it's not sharp. How are you feeling after all that?
That was actually a lot better than I was expecting. I know this is probably a hassle for you because I'm so nervous, but thank you for being so kind.
Oh, of course. It's not at all a hassle. It's really common for people to come in with dental anxiety. It's a pretty scary place with all the scary instruments, but I know once we break it down, it's a lot easier for you.
Yeah, for sure.
Yeah, it makes me more comfortable. Perfect. So the dentist is going to come in soon. She's just going to take a look at everything I've done, making sure everything's perfect. And then if it is, she may or may not prescribe some x-rays. If she does, I'll just take some x-rays and we'll check deeper than what I can see. Yeah. Here she comes now. Dr. Regina Phalange, this is Jacqueline Walsh.
Hi. Nice to meet you. You too.
Perfect, let's get started.